So hello everyone, I'm Becca. I'm a Community Development Officer, so I look after the Community Advocate Programme where we deliver these free first aid awareness sessions to groups like yourselves. I've got Debbie on the call as well with me. She is a community advocate, so she's just shadowing the session just to see how it goes, so she can hopefully do them in the future, which is really exciting. So we're going to look at the emergency first aid package today. So nothing that we go through or show you is graphic in any sense. But obviously I understand that if anything is upsetting for anyone, please do feel free to take yourself out of the room, take 5 and then come back when you're ready as well. So the aims of the session is to provide you with vital life-saving skills, increase your general knowledge of first aid, prepare you for an emergency situation, give you the confidence to help others, and tell how you can become a community advocate as well and deliver these sessions in the future. So when we come across a patient, the first thing we want to look at is patient care and communication. So we want to make sure that we call for help. So first thing we're going to do is call for help. So like I said, this could be us calling 999, or this could be us getting bystanders, so people who are around us who could either help us, whether that's calling 999 themselves or helping us things like put bandages on and stuff like that as well. So the next bit we're going to do is we need to make sure that we listen to them and we keep calm as well. So if we're calm, the patient's more likely to be calm as well. And by listening, we can find out, what's happened, has it happened before? And ultimately, this information we might need to pass on to the paramedics when they arrive as well. So we've also said about protecting yourself. So a lot of what we go through today will still have a lot of COVID regulations in, because just in healthcare, they're still relevant, although things are relaxing within the country. So everything you'll see a lot of things saying maintaining social distancing or wearing face masks. It's just because this guidance is still out there, so that's what we need to do. So also we need to protect ourselves. So again, this could be wearing gloves or a face mask or a face covering as well. Now, a lot of what we can talk about today, we're talking about giving early treatment. So we might not necessarily be able to resolve the issue and make them better straight away, but we can certainly start with early treatment so their condition doesn't deteriorate and they don't get any worse as well whilst we're waiting for the paramedics. So we've also put reassure, so reassuring patient as well. So tell them what you're doing. If you phone 999, tell them that. Tell them, find out what else has happened as well. But we've also put reassure bystanders. So bystanders could be family, friends of that loved one, of that patient as well. So again, for them, this could be quite a distressing situation. So we need to talk to them. Again, tell them what you're doing at all times and find out from them, did they see what happened? Has this happened before? Get a bit of a background information, because again, that information we could pass on to the paramedics when they arrive. And then finally, dispose of any waste safely too. So when we come across a patient, we have a little acronym called Dr. ABC, and we can use this to make sure that we keep ourselves safe and get some more information on the casualty's condition. So D is danger. So is it safe to approach? And we're looking for hazards. So this could be anything that's on the floor that you might be able to trip over, slip over. Hazards could happen up above as well. But danger could also apply to a situation as well. So if a situation is dangerous, is it safe for me to approach? Ultimately, we're there to help the patient, not to become another casualty ourselves. If you find you're in a dangerous situation and it's not safe, obviously you would call 999 and you would get the police there to deal with the situation as well. So R is response. So we're looking for some sort of response from the patient. So this could be a simple eye roll, a moan, a groan, some sort of movement. They might start talking to us. But there are various ways we can get a response. So first of all, you've got shouting in both ears. Why do you think we would shout in both ears and not just one? Any thoughts on that one?
Someone said they could be deaf.
Yeah, perfect. So they might have hearing in one ear only. So, when we're shouting, we know saying, hello, can you hear me? They might also have an internal injury that's affected their hearing and we can't see that. So it's really important that we do it in both ears to start off with. Another way is you can tap the shoulders. If you go down to your collarbone, tap your collarbone, it sends a bit of a vibration through your body as well, which very quickly gets very annoying. So if they were going to respond and tell you to get off, they would very quickly. Last way to respond is a pinch in the earlobes as well. So that's sort of more of a pain response, seeing if they respond to that. If we haven't already done so already, we need to call for help. So again, like I said, whether that's us calling 999 or getting our bystanders to call 999. So we've looked at the dots a bit. So now we're going to look at the ABC. So A is airway. Now it says start off with to place a covering over the mouth and nose of the patient. This doesn't block their airway. This doesn't suffocate them or stop them breathing. It's purely to protect yourself with COVID as well. So to open an airway, you put 2 fingers under the chin and 3 on the forehead, and you gently tilt their head back. By having your fingers on the chin and the forehead, it just gives us better control over their head when we tilt it back. We're not trying to snap it back, snap their neck. We're just opening the airway. B is breathing. So before we used to probably put your face near the patient, see if you can feel anything. But now we just simply watch the chest rise and fall. As it rises and falls, we can see that they are breathing. If they're not breathing normally, we need to call 999 and start CPR, so chest compressions only. And we'll talk about that in this presentation as well, what that is. Or if they are breathing normally, so their chest is going up and down, but they're not responding to us, we need to put them in what's called the recovery position, and we'll talk about that as well. And then the last one is circulation, so checking for signs of bleeding. So we check right from the head all the way down, arms, stomach, legs as well. Obviously, when you're doing these checks, making sure that we say and talk what we're saying. So if we're checking, just checking for any injuries, any bleeding or anything like that, because ultimately that we might need to deal with first before anything else. Any questions with anything we've gone through so far?
No questions so far.
Perfect. So the next one is emergency call. So we've got 2 numbers you can ring. So you've got 999, which I'm sure a lot of us are aware of, and we've got 112 as well, which can be anywhere in the EU. So when we ring for the call handler, we need to make sure that the information we give is accurate. We are clear with what we're saying, and we stay calm as well. So some of the things they'll ask us is our location to start off with. So we might know exactly where we are and tell them straight off, which is brilliant. We might not. We might have to look around. What's around us? Is there any landmarks? Is there any town names we can see, any road names? We might know exactly where we are and say we're outside this shop. Whatever we've got to help us with the location as well. A lot of people have smartphones nowadays, so a lot have the Maps app as well. So you could always look at that as an option. And the other thing is the casualties condition. So this links back to our Dr. ABC, which we've just done, which is why it's so important that we follow that. So we can tell them if they're breathing and conscious, if they've got any injuries as well. So someone who's breathing and conscious and chatting away to you will be a lot lower priority than someone who is unconscious and not breathing at all. So it's really important that we pass that information on. Obviously, never ever leave the patient to go and make a 999 call. If you are on your own and you have got a mobile on you, put it on speaker so you can attend to the casualty at the same time of dealing with and talking to the call handler as well. So the recovery position. So we mentioned this is when the patient is breathing, but they're not responding to us. So we've tried shouting in both ears, we've tapped them on the shoulders, pinched the earlobes, and we're not getting anything. So we do have a YouTube channel which shows this being done by actors. So if you learn better visually, I would definitely recommend looking at that afterwards. But I'll talk you through it, showing the pictures that we've got on the screen. So to start off with, you're going to kneel down by the side of the patient, and the arm closest to you, you're going to put out at one side. Now, the picture shows it quite a lot as a right angle. Now, a lot of adults and people can't put their arms out at right angles and certainly sort of pop shoulders out. So just out to one side is absolutely fine. We just want it out of the way. So the side that's furthest away, you're going to take their hand and put the back of their hand on their cheek across their face as well. So remember, your patient is not responding, so their body's going to be very floppy, so they're not going to be able to hold that there. So we need to put our hand on just to make sure that that stays in that position. That same side with the leg, we're going to lift the knee up, so the knee's up and the foot is flat on the ground. Once it's like that, we can use that knee as a lever to roll the patient towards us, remembering that we've still got one hand on the patient's hand, and the other hand will roll the patient towards us. Once we've rolled the patient towards us, we can slowly move our hand away, often lowering their head. We don't want them to have a head injury. The leg that we've used to roll over, we put it at a right angle, and then the very final step we do is to open the airway. So 2 fingers underneath, 3 on the forehead, and gently tilt it back, and we open the airway. From this way, we can monitor the level of response of that patient. If they're sick for any reason, they're not going to choke on it because it will just naturally sort of fall out as well. So we haven't got that to worry about either. So this slide is slightly different to some of the others that we've started looking at, and it's more of a myth-busting slide. So there are a lot of myths about people can swallow your tongue and it's going to vanish and disappear. Your tongue's a muscle, is very much attached in your mouth and it's not going anywhere. But by opening the airway and tilting the head back, what we do is we lift the tongue off the windpipe, which allows that patient to breathe a lot easier. So you're never ever going to lose your tongue. So if anyone says anything like you can swallow it or lose it, you're not. But just by opening the airway, it does lift it off your windpipe, which does allow them to breathe easier. So it's more of a myth busting slide, this one, and hope we sort of get rid of that and tell you all the facts instead. Is everyone okay with the slides, the previous slides we've gone through?
Does anyone have any questions or no, that recovery position or anything? No, not yet. No questions.
No, that's absolutely fine. There will be opportunity at the end as well, but I just want to make sure as we go along that everyone's happy. That's not a problem. So the first topic we're going to look at is choking. So if someone is choking, or we think they are, we're going to ask them first of all, are you choking and can you cough it out? Now, if they respond to us and say, yes, I am choking, they're probably not. They've probably just got something gone down the wrong way, a little bit of a tap, and they'll be okay. Someone who is choking will be very red in the face, very flustered, very panicky, that sort of clutch in their throat, sort of desperate for someone to help them. So we need to try and encourage them to cough it out to start off with. If that doesn't work, we do what's called back blows. So we try to slap it out. So using the picture at the top right, you can see that we've got the patient leant forward. We put our hand across, holding their shoulder, just to give them that support as well. And the back blows happen in between the shoulder blades. So the motion for a back blow, it's not flat. It's using the heel of your hand, and it's more of a down and up motion. So it's down and up. And the reason for that is often, if you think about it, we want something to come up and out, whatever's lodged. So we do 5 of them. After every back blow, we're checking the floor and checking the mouth. So it'll be back blow, check the floor, check the mouth. Back blow, check the floor, check the mouth. If we see whatever is lodged in their mouth, obviously don't go sticking your fingers in their mouth to get it out, because inadvertently we could push it back down. Just let gravity take its course and let it naturally fall out as well. If that doesn't work, we now need to squeeze it out, which is what we do abdominal thrusts with. So if you find your belly button and just go just above that, that is where you're going to do it. So to do abdominal thrust, obviously you're going around the patient, you make a fist, you put your hand over the top, and the motion is in and up, in and up, in and up. So again, whatever is stuck, we want to come up and out as well. Same as before, after every abdominal thrust, we're checking the floor and we're checking the mouth of the patient to see if whatever it is dislodged. If after that we still have not been successful, we need to call 999 and get the help. Tell them that you've got someone who's choking and get an ambulance sent out. Obviously, whilst we are waiting for the paramedic, so again, this talks about going back to when we talk about early treatment, we continue the cycle. So we continue with our 5 back blows and we continue with our abdominal thrusts until whatever it is lodged comes out. The paramedics arrive and they take over, or the casualty goes unconscious and stops breathing. We might have to do CPR as well. They're the sort of the only reasons why we would stop, but we keep going otherwise. So the next one is severe bleeds. So often just sort of put it into context. So we sort of say like minor bleeds are more sort of your cuts and grazes that you can deal with at home, probably stick a plaster on and you sort of get on with your day. So severe bleeds, often there's a lot more blood. So we're going to often encourage the casualty to help themselves under our instruction. So what we mean by that is if we want them to hold something or apply pressure with us guiding them, they can do if they're able to. Straight away, we need to protect ourselves, so wearing any gloves as well in particular, and we're calling 999 before we do anything, getting that help we need. Now, whilst we're waiting for the paramedics, we need to clean the wound. What can you use or what can you do to clean a wound? Any thoughts?
Any thoughts?
Antiseptic wipes.
Antiseptic wipes.
Yeah, perfect.
Anything else? Yeah, water.
Yeah, brilliant. Anything else?
Alcohol.
Alcohol.
If you're carrying any.
Yeah, maybe a bottle of gin if you've got one at hand.
Maybe not that, because they'll probably sting more, but yeah. So
A lot of pain.
we're looking for more like, you know, like the wipes or the water, whether that's from a tap or a water bottle, for example. You might be out and about and might not have anything and might only have something like a clean tissue. And if that's all you've got, that will do. So sometimes you do have to be a little bit creative with this. Yeah, they're all very good examples. So then once we've cleaned the wound, we now need to control the bleeding. So we're applying direct, firm pressure. So we want that blood to clot and that bleeding to be under control. Once we've got the bleeding under control, we now need to cover the wound. So obviously, if there's an item in the wound, what you would do, so if this is my item, you would put something either side, so padding or dressing either side. And what you do is you'd wrap it into almost like an X shape. That way you're keeping that item secure and also you're keeping the pressure on. So you're not still having the bleeding under control too. Obviously, if there isn't anything or an object in the wound, that's absolutely fine. You would just wrap a bandage around like normal, again, making sure that we still keep that pressure on to make sure the bleeding is under control as well. If more blood comes through the bandage or dressing once we've applied it, we need to remove it and start again. Before, you used to be able to put another one over the top and then remove it, but now it's changed to once it's what come through one, remove it and we start again. If we're awfully having to remove a bandage, we probably need to take a step back and control the bleeding because often it's bleeding a lot, and before we reapply a bandage as well. Now, the next bit is to lie them down to prevent them from shock as well. So making sure, also, we have the pressure. So to prevent them from having shock or treat it, we need to elevate their legs, which is shown in the picture above with the chair as well. So we just need to elevate their legs and monitor that. Obviously, we've said about sort of monitoring the injured area. So obviously, I've told you to apply direct firm pressure and make sure we've got the bandage on nice and tight, but we might have done it a little bit too tight. So if the area becomes a bit swollen or purple, we might just need to loosen off that bandage a little bit because we don't want to stop blood circulation completely. And also just monitor the patient and their response as well. So keep talking to them, keep that reassurance as well until help arrives. Any questions on the last couple of slides we've done?
Yes, there's a question.
Yeah, that's fine.
Yeah, okay. So you said that to raise the legs to prevent shock, but does that apply to any injury that occurs on the body?
So you said to raise the legs to prevent shock, but does that occur or does that relate to every injury on any part of the body?
So yeah, I mean, they could have an injury on their arm. And we still elevate the legs. All it does is by elevating the legs slightly, it just gets the blood back to the vital organs. That's what the main purpose of it is. Right. So obviously, if you've got a leg injury, though, you'd probably put the leg down that's got the injury and just lift up the leg that's okay as well. But obviously, making sure that we keep that pressure on with the bandages as well.
Great. One question I have actually is you say if there's an item in the wound, not to remove it. What's the reason for that?
So it acts as a natural plug. So as soon as we take that, we're going to have blood everywhere. So it acts as a natural plug for us. It's stopping blood from escaping at the moment. And we want to control that bleeding. That will get sorted when it's out at hospital in a more sort of controlled environment as well. So we keep it in there because it contains the blood, because often we don't want them to bleed out and it to be a lot worse situation than it was to start off with. Lovely, thank you. Any more questions at this stage? Yes.
If a patient goes into shock, what do you do?
If a patient goes into shock, what do you do?
So straight away, so shock is sort of a life-threatening condition. So we would call 999 straight away. A lot of things, so like severe bleeds, it happens with like some heart-related burns as well. You probably, for more severe stuff, you probably already would have phoned 999. But that's the first thing. And obviously then we need to try and treat the cause of shock. So in this case, if it's a severe bleed, we'd obviously try and control that bleeding and cover the wound. And then for shock, it is just elevating that leg. So it could be a chair, it could be your knee, it could be a pile of coats, a pile of bags, just something that would elevate that patient's legs so the blood goes back to their main vital organs in their body.
Lovely, thank you.
Thank you.
All right, yeah, I think we're ready to go on the next slide.
Cool. So the next bit we're going to look at is a cardiac arrest and a heart attack. So just out of interest, did people think there was a difference? Did people think they were the same? Because we do get quite a mixed response with this one.
Does anyone know the difference, or did you think it was the same thing between a cardiac arrest and a heart attack? Do you think that was the same or different? Different, yeah, I thought it was different actually. And yeah, quite a few students are nodding, they thought it was different. Good,
so that's good. So a lot of people sort of think there's a difference but maybe don't understand the difference, or some people think they're sort of the same thing. So what we'll do is we'll just have a look and then we'll go through each one in more detail. So a cardiac arrest is an electrical problem. So the person is unconscious, you'll be calling 999 straight away and we start CPR. Where a heart attack is a circulation problem. So the person's probably conscious, but again, we're calling 999 and we keep them calm. So over the next couple of slides, we'll look at each one individually, look at the signs and symptoms and how to treat it as well. So a heart attack happens when the supply of blood to part of the heart is suddenly blocked, usually by a blood clot. So these are, I would say, typical signs and symptoms. Every person is different, but typically the signs and symptoms of a heart attack are one or few of the following. So they'd have a crushing pain at the center of their chest that may spread to their jaw and down one or both arms. They'd be breathless or sort of gasping for breath as well. Sweating a lot, sort of experience pain similar to indigestion. They might collapse without warning. Complain of being sort of dizzy, their skin would be quite pale and their lips would certainly have like a blue tinge as well, because obviously we haven't got that oxygen going around. They'd have a rapid, weak or irregular pulse, and they'd have a feeling of impending doom. Now what we mean by that is sort of the feeling of the unknown and the not sure what's going to happen, and that feeling of, you know, am I going to die, is often how it gets described by people as well. So that's what we mean by the feeling of impending doom. So heart attacks can lead to a cardiac arrest, so it's really important that we are prepared just in case. So ways that we could possibly prepare ourselves is, if we know there's something like maybe a defibrillator nearby, we could go and get one and just leave it in the next room, or just leave it outside the door, just not to alarm the patient either, but just so you are prepared if so. So one heart attack happens every 5 minutes in the UK, which is a pretty scary stat. So what to do if someone's having a heart attack? So we get them to, first of all, we're calling 999 and we tell them that we've got someone who suspects having a heart attack. We sit them down in what we sometimes refer to as the lazy W. So their back is against something, quite often a wall, and their knees are up and bent as well. And this is often a position that they find quite comfortable if they're having a heart attack. And obviously we want to try and keep them as calm as possible. Now, if we've got some aspirin around and they're not allergic and they're able to have it, get them to chew 300 milligrams. And what this does is just thins the blood, which hopefully will relieve some of those signs and symptoms whilst we wait for paramedics. Now, apart from calling the paramedics and getting them to sit down and keep them calm, there's not really a lot else we can do. A lot of the treatment for a heart attack happens when they go to the hospital. So it is very much just monitoring them, keeping them calm, but obviously being aware that they might go into a cardiac arrest and become unconscious at some point. So let's have a look now at a cardiac arrest and see how that changes. So a cardiac arrest occurs when the heart suddenly stops pumping blood. Oh, there we go, around the body, often due to issues with electrical signals to the heart muscle. So it can happen to anyone at any age. So there are people seem to think that happens to middle-aged men in your 40s. You're the ones who have a cardiac arrest. It can happen to anyone. It can happen to kids, older people, younger people. You can be fit and healthy. You only have to look at that footballer in the World Cup last year as well. So it can happen to anyone. So signs and symptoms of a cardiac arrest compared to a heart attack are a lot shorter. So we've got sudden collapse. They're unconscious and they're not responsive. They're not breathing, or they're not breathing normally as well. So if someone is having a cardiac arrest, we need to call 999. Start CPR straight away. We'll talk about that in the next slide. And we'll look for a defibrillator as well, if there is one. If there isn't a defibrillator nearby, don't worry about that. It's more important that we continue with the CPR, because the paramedics will come and bring one when they arrive as well. So just before we go on to CPR, is everyone happy with the two topics and the differences that we've just gone over?
Yeah.
Brilliant. So CPR. So again, start off with, obviously we phoned 999 because we've got someone who's in cardiac arrest. Now, if you forget everything that I've told you in this presentation, you're in a situation where you need to do CPR and you go, oh, what did she say? I can't remember. Don't worry, the call handler will go through it all with you. They will tell you where to put your hand placement. They will tell you how to have your hands. They will tell you, they'll give you a beat as well, so you'll be able to do it yourself. Obviously, if you've got people around you, see if they can go and find a defibrillator. We've always said that if not to worry. And if you've got someone nearby, obviously this has got quite a lot of COVID bits in, try and put your phone on speaker so you can deal with the casualty as well as talking to the call handler as well. And obviously, like before, when making a 999 call, never leave the casualty to look for a defibrillator. They will come with one of the paramedics. So you would put a covering, again, over the mouth and nose of the patient. Again, that is purely to protect yourself. And we're doing 30 chest compressions. So it's the center of our chest. Now, when we do our chest compressions, you can either interlock your hands or you can put one on top of the other like that. So that's absolutely fine. Quite a lot of people do interlock and do chest compressions that way. So we are looking to do, like I said, 30 chest compressions, about 5 to 6 centimeters deep. So it's 2 to 2.5 inches. And we're looking at doing 100 to 120 beats per minute. So ironically, the song Staying Alive is a good sort of beat. If you hummed that, would be a good, perfect tempo for doing CPR.
Does everyone know that song? Staying alive, staying alive. Yeah.
So once you've obviously done your 30, you might take a momentary quick pause and then carry on again. So we'd want to keep the CPR going for as long as possible, and obviously we continue until help arrives. Now, obviously, if you're on your own, doing CPR is very tiring. So you might end up having to, obviously, and the paramedics don't want to come and find you. They've got 2 patients to deal with, you because you've collapsed with exhaustion, and the other patient who's in cardiac arrest. So if you're on your own, you are tired and you do have to stop, please do stop and then continue when you're ready. But obviously try and keep going as much as possible. There is nothing stopping you, if you've got a group of people, regardless if they know how to do it or not, to say, right, you watch me and then you're going to take over, and you get someone else to watch you whilst you do CPR and say, right, you're going to take over, 3, 2, 1. And they take over, which allows you to have a break and to ensure as well that you have effective CPR continuing on that patient as well. Everyone okay with CPR?
Yeah.
Brilliant. So the next bit we're going to look at is defibrillators, or AEDs is what they're also known as. So an AED, so that stands for an automated external defibrillator, is a device that gives the heart an electrical shock when someone's heart is stopped, so they're in cardiac arrest. It temporarily resets it to a normal rhythm, and they're all safe to use on all adults as well. So anyone can operate them. You don't need to be named, trained, or even own one as well. So defibrillators, they give you very visual and verbal prompts as well. So these prompts are loud, they're very simple, and they're very clear. So they'll say things like check in heart, analyze him, shock him, stand clear. So nothing is complex what they say. It's all very short, snappy words and phrases as well. If you've got someone who, say, is hard of hearing, so they can't maybe hear the prompts, on the screen of a defibrillator, it will have written what the prompt is, so they can still read what's going on around, even if they can't hear it. Obviously, they're safe as well, so that it checks the heart's rhythm and only shocks it when needed. So you can't go sticking a defibrillator on someone you don't like and try and shock them. It won't work. What it does is, whilst you're doing CPR, it will analyze the heart and see if it needs to shock or what the next steps are. And they're accessible for anyone. Everyone and anyone can use them at any age as well. But obviously, like we said, if you're alone with the patient, just continue with your CPR. That is the most important bit that we do. So before we talk about how to get to defibrillators and access them, where you're all sat now, do you know where your nearest defibrillator is?
Do you know where one is on your school premises at all? Have you seen any that look like that? No. Does anyone think they have one at their school? No. That's something which we can raise with the school following this, isn't it? That would be amazing if they get one as a result of this.
Wow. Do you have any maybe outside of school, so quite a lot of shops or anything like that have them, or community centres as well?
Near you where you live, or shops? Yeah, some people are nodding yes, others are nodding no.
So now we've had this conversation, you'll probably all notice them wherever you go. It's just sort of a trait of this presentation. But yeah, it's definitely something to look into. And obviously they are really trying to get a lot more public access to defibrillators out there. They really do help if needed as well. So if we need to access one, obviously we phoned 999 and we've already said we've got someone in cardiac arrest. Now on a defibrillator, they'll have a little code, so it's almost like it's location code, and you would give that to the call handler, and what they would do is they would give you a passcode which you can then type in and unlock the box, and inside the box there'll be a smaller box which has the defibrillator in there. So we need to remove that and take that to the patient. Obviously, sometimes inside the box, it might have scissors. So with the pads, they need to be on bare skin. So if someone's wearing a t-shirt or a jumper or something like that, we might have to just cut through their t-shirt and top because we need the pads to go on bare skin. There would also be a cloth on there as well, because obviously we said they might be sweating a lot as well, and we need the skin to be dry, so we might have to use the cloth to dry the sweat away. If there isn't a cloth, you've just cut their t-shirt or jumper, they're not going to wear it again, just use that to dry the sweat away, so it's nice and so it's clear for the pads as well. And there's also probably a razor. Now obviously we don't want particularly sort of men with sort of chest hair, we don't want them to have singed hair, we don't want that smell going around, so we might have to quickly shave their hair where the pads will need to go as well. So how do you use a defibrillator? So obviously, like we said, you call in 999 to start off with and getting that help. We're not leaving the casualty to go and look for one. The paramedics will come with one. And obviously, if we're on our own, we put our phone on speaker so we can start CPR whilst we're talking to the ambulance control as well. Now, we continue with the CPR. That's the most important bit, obviously, until help arrives as well, or until the defibrillator arrives. So once that's arrived, we switch it on. So most of them is just one big button, press it. Like I said, we need to remove or cut through any clothing. So notice at the picture at the bottom that you've got one person doing CPR, another person cutting the clothing. Now that person who's cutting the clothing and wiping away the sweat and putting the pads on needs to work around you as the person doing CPR, if that is you. You might have to stop momentarily while they cut, because we don't want them to cut through our hands, but then you're straight back onto it. They work around you. It's really important that we continue that CPR as much as possible. Like I said, we're wiping away any sweat as well, whether that's using the cloth within the box or that's using the t-shirt that we have just cut out. So we need to apply the pads. So the pads on defibrillator, they just have sort of like a sticky back covering. So we can just take that off. And quite often the pads will have the position shown on them. So they might tell you where they are, or quite often it doesn't matter where you put them, but there will be some sort of visual guide. So you've got that as well. But the first pad should be on the upper right side, just below the collarbone. And the second pad is on the casualty's left side, just below the armpit as well. So effectively it goes straight through the heart. The next bit, once you've got it on, is very much just listening to the defibrillator and listening to the prompts that it gives you. So it will analyze the heart, and it will tell you what it wants you to do. It will tell you to stop CPR as well, if it'll tell you when it's shocking, and it's just a case of listening and following to what it needs you to do. Obviously, if it has shocked, it will then tell you to continue CPR for another 2 minutes. Now, in those 2 minutes, it is reanalyzing that patient's heart, seeing if it needs to do another shock after those 2 minutes. But it is very much just sort of listening and going along with what it's telling you to do. Now, your patient might become responsive, which is great if they do. So signs of response can be like coughing, they might open their eyes, speaking, and they might start sort of breathing normally. We put them into the recovery position. Now, notice in the picture with the recovery position that we've left the pads and the defibrillator on and attached to the patient. Now, just because they're conscious and responsive now, we need to obviously monitor their level of response and be mindful that we might have to do CPR again and we might need the defibrillator. So it's much easier just to leave the pads on than to faff around taking them off and then realize you need them and then put them back on. So just leave them on, even if they become responsive, because then it's always there ready for you. Any questions on how to use a defibrillator, or any questions about how to access it or anything like that?
How do you get access to it? Like, I mean, is it like these two junky things you hold on to, or what does it come with?
Yeah, so gaining access to it, I think you said you have to call 999 and they'll give you a code to put into the box, the outer box. Then that opens and then the defibrillator's inside there. So then you take the equipment out, don't you?
Yeah. So the public access ones all have a code, obviously, so you don't, apart from in London, I believe in London, they're not coded, they're all sort of open so you can get them. But most of them are coded, so often they don't get vandalized or nicked, because often they are really important. So you would just give them that location code and they would give you a passcode to pop in, and the defib will be in the bigger box as well.
Yeah, and I think it comes with instructions, she said, so then you can pop that in. Yeah,
it is very much just, it comes with instructions, very much just as soon as you press the on button, it's talking to you, it's telling you what to do. It is very, very simple to use. They are.
Any other questions? Nope, no questions.
Perfect. So a lot of what we've gone through, we've spoken about sort of calling 999, but there are other services around. So we've got self-care. So this is things that you can deal with at home. So if you've got minor cuts and grazes, can we put a plaster on it? If you've got a headache, can we take some ibuprofen? Cough and colds, we've got cough mixture, things like that as well. And we've also got pharmacy. So pharmacists do a lot of very similar training to doctors. So you might go to them for more like minor illnesses. They could give you awfully advice and say, you can buy this over the counter that might help. They might say, actually, you need to go and see a doctor and get something stronger. But also a lot of pharmacists are open later as well. So that's always a good bonus if you need them. And we've also got NHS 111. So if you're feeling unwell or you're not really sure what service you need, you can ring them and they can help you out in that way. So that might be that they book an out of hours doctor's appointment for you. It might be that they suggest, actually, can you get yourself to A&E, or actually you are really poorly, let's send out an ambulance for you as well. So there are quite a lot of options that they can help you with too. And we've also got your GP, which I'm sure a lot of people are already aware of. So you've got more like persistent symptoms or sort of long-term conditions you might go to them for as well. And they can give you that advice, guidance, and also prescribe some stronger medication. And then finally, we've got A&E or 999. So some of this we've already covered for why you might need them. So we've got choking, chest pains, or blacking out, or serious blood loss. Obviously, though, if anything is wrong with anyone, so so family, friends, loved ones, please do go and get yourself checked out. They'd rather you call 999 and get checked out and say, actually, you're fine, or do observations and send you in, than to not ring. And what we find at the moment, people aren't ringing, and then actually by the time they have, their conditions deteriorated quite a lot. So please make sure you do get the help you need when you need it. So we've gone through quite a lot of information this afternoon, but there are different ways that we can keep informed. So we've got our website, which has a lot of resources on as well, and a lot of extra support. We've also got a YouTube, really good. It goes through first aid topics with actors. So if you learn visually, that's a really good tool, and I definitely recommend looking at it. We've also got the Sunderland Ambulance app. So this has a lot of first aid topics on there, shows you sort of signs and symptoms, how to treat them. You can use it without any signal as well. So if you were out and about, you didn't have any signal and you had a situation, you could always use it then to get some advice. And obviously we're on our social media as well. So for us, we are, like I said, I look after the community advocate programme, where we deliver these free first aid awareness sessions to groups like yourselves, so hopefully build up the confidence and knowledge of first aid and build up that resilience as well, that people aren't afraid to help, whether that is just simply calling 999 or having to do CPR as well. If it's something that you're interested in terms of commitment, we only ask for 3 hours a month. So it's about 2 sessions. You can drop me an email directly with my work email, or you can go to community.engagement@sga.org.uk, and I do look after that inbox too. So just let me know and I'll be more than happy to have a chat with you about that one.
Great. If anyone wants to as well following this, you can just send me an email and I'll pass on the details.
Perfect. So all that's left from me is to say thank you. Thank you very much for listening. Let me just stop staring my screen. And if anyone's got any questions, I'd be more than happy to answer them.
Yes, you've got a question.
Like post-COVID-19, is it ever going to come back?
Yeah, as you're saying, with mouth to mouth and post-COVID-19, how is that going to be handled? Is it ever going to come back, or do you always need like a cover, do you say?
So at the moment, obviously, we're not doing face-to-face, mouth-to-mouth. So the rescue breaths, it is just purely chest compressions. So it's been proven that chest compressions on their own are just as effective as we're doing the rescue breaths and chest compressions. So for now, it is purely just the chest compressions only. At the moment, I'm not sure if it will ever come back, because obviously we're still sort of effectively in the pandemic. There's still COVID cases going around, and obviously that change did happen as a result of it. But for now, it is purely just sort of chest compressions.
I know you can buy like a special medical covering as well for CPR, because I used to have one in my wallet. But that's something which, like they said, it's not recommended at the moment, but if it ever does, then you can buy them. They're very slim and you can keep them in the bag. But like Rebecca said, at the moment, because of COVID, it's not recommended, just the chest compressions. Any other questions? Yes.
For the recovery position, how do you ensure that, like say, limbs are not bruised or damaged, because all the muscles are relaxed? How do you make sure that maybe like joints haven't been dislocated when you move them into that position?
So with the recovery position, I don't know if you heard that, but how would you ensure that you don't damage any joints or cause any bruising when you do that?
Yeah, so obviously they're not responsive. Their body is very sort of floppy to start off with, so they're already relaxed, their body. And obviously we're not throwing them around or anything like that, but we do have to move them. So a lot of it is, very gentle. Once you've got your leg up, you use the knee as a lever, so we're not dragging or pulling any muscles in the way they shouldn't move. So we're using that knee as literally just a lever to help us. We've got our hand on to lower their head carefully, which will effectively end up on their arms. So they've sort of got a pillow as well. You're bringing your leg forward from that as well. It is a comfy position for them and will help them. And obviously if you did pull them, they're probably more likely to get bruises. But the way you do it, it's all very careful. So they might get a little bruise, but they'd much rather have a little bruise than to be unconscious than actually end up getting worse and you have to do CPR and whatever else. Bruises come and go, don't they? But if they lost their life, that's it, they're gone, isn't it, unfortunately?
Yeah, lovely. Great. I think that's it, unless there's any other questions. No, wonderful. Thank you so much, Rebecca.